I was actually a physician working in the Mayo Clinic in Rochester. And I knew the physicians who were initially starting the program and had come down with those physicians in the first year of the transplant program to be part of the new transplant program that was starting here.
And when we found out that Mayo Clinic was going to start a liver transplant program, I was like, wow, what a fascinating thing. I would just love to work there.
Buzz was in the air. A lot of people were excited about what was going on. All the departments were working together to try to formulate a practice model that was going to be successful.
We worked very, very hard to put together a program that brought in resources from all aspects of medicine.
We had a need for someone to fly Mayo doctors from here to different hospitals for transplant, and started doing that. I was the only pilot, and eventually we added another pilot.
We had one hepatologist and one surgeon, obviously Dr. Spivey and Dr. Steers, and then we finally got Dr. Wynn.
From this is a small hospital, we were able to bring in an excellent liver transplant program within a short period of time.
You have to realize there had never been a liver transplant patient in this hospital, and we had to learn everything from the ground up, literally, how to do the dressings, how to manage their medications, which was a whole realm in itself.
There was a whole group of drugs that we didn't know anything about, so it was a steep learning curve, lots of phone calls to our colleagues up north, and but we made it through.
It was an amazing time back then to see it grow.
Success came from the dedication and the commitment of our LA Health and our physician and surgeon.
And I remember the first year our goal was to do 12 liver transplants, and we actually did 54. So we went way beyond the expectations, and everything went really well.
This was about transplant, it was about the patient, it was exciting, and we cared deeply, and you take a lot of pride in that.
I was diagnosed with liver disease probably about approximately 15 years ago.
I just didn't have the strength, and I was always, sick or having to stay in bed.
We were living in a two-story house, and I couldn't go upstairs. I got where I was so weak that I could. So we put me a bed in the living room on the floor, actually living, I guess, the last 3 or 4 months of my life on a mattress on the floor.
I sought appointments with liver transplant centers in the United States, and finally I was accepted at the Mayo Clinic.
It was the best piece of hope that I had had in a long, long time. So
I came to Mayo because I'd always heard about Mayo, and I just felt like they'd tell me, what was wrong with me.
Actually, I had a small suite across the street from the helicopter port, and many times when I was out walking and I'd see the helicopters or hear the helicopters coming in, I was hoping that maybe there's a liver transplant there for me.
And the next thing I know, I woke up, and that's where the wonders of Mayo began.
So 5 hours later, I was back in my room, and I was speaking to one of my friends who had come from 10 hours away.
it was just like night and day. I went from yellow to a real rosy complexion, and was out of the hospital in 5 days.
One of the things that really, really impressed me the most, I get a little emotional, is the staff.
The people here could not have been more friendly and could have helped more.
They go above and beyond to try to help patients, to try to make them feel welcome.
When they would go over these procedures, they would they would speak in layman's terms as much as possible and make it as easy for the patient to understand as possible. For donors out there, and this is where I'll probably lose it,
if it wasn't for those 2 people that were organ donors, I wouldn't be here.
Been to a donor hospital where the surgeon himself actually had a child, a teenager who was dying and was willing to donate the organ, and he himself met with me and took her to the OR.
His mother said one of the saving graces was to know that he saved as many as I think 5 people.
I never really thought about organ donors. Prior to this point, I never gave it a whole lot of thought. But now that I'm on the receiving end, it's really opened my eyes.
My whole life has changed, even my relationship with my family, my relationship with friends.
The Mayo Clinic gave me a gift of life.
I got a second chance because of this grand experience. I've tried to do some better things with my life.
We had a young girl come over from Mexico to have a transplant.
And I still get choked up when I think about her.
I was a young patient, and they just made me feel at home.
It was I think just because of her age, that it's just hard to imagine that someone can be that sick.
That kind of touched me early on in the program.
She'll always be a special patient for me.
And I work here at the Mayo Clinic, helping patients. I just felt like when this first happened to me, I didn't know why it had happened to me, and I would often ask that question, why me? What did I do? You know, what is it that I need to do? And I really didn't know, and I still don't know why, but I know that because of it, I am here now, which I am very grateful for, because I had a second chance, and not a lot of people get that.
I think the reason that our program is as successful as it is the individuals involved in the program.
I feel like me as an employee, I understand why they're here and how they're feeling in a way. I mean, I know we're all different, but it makes me remember when I was there. So I try to make them feel the way I felt, the way the staff treated me. I want to treat them the same way.
It's just a grand experience. I just delight that I've been blessed to have that experience.
I'm very grateful.
It's a wonderful thing that Mayo done for me, and I will never, ever live to be able to repay Mayo and the people that helped me.
This is the most precious gift